Cranial nerves assessment. Cranial nerve 1, olfactory nerve. Have the patient identify a familiar scent with the eyes closed. Cranial nerve 2, optic nerve. Have the patient read from a card or newspaper, one eye at a time. Test visual fields by having patient cover one eye, focus on your nose, and identify the number of fingers you are holding up in each of 4 visual quadrants. Cranial nerve 3, oculomotor. Check the pupillary responses by shining a light on one pupil. Both pupils should constrict. Do the same for the other eye. To check accommodation, move your finger toward the patient's nose. The pupils should constrict and converge. Have the patient look up, down, laterally, and diagonally. Cranial nerve 4, trochlear. Have the patient look down and in. Cranial nerve 5, trigeminal. Ask patient to hold the mouth open while you try to close it, and move the jaw laterally against your hand. With the patient's eyes closed, touch their face with cotton and have them identify which area was touched. In a comatose patient, brush the cornea with a wisp of cotton. The patient should blink. Cranial nerve 6, abducens. Have the patient move the eye from side to side. Cranial nerve 7, facial. Ask the patient to smile, raise eyebrows, and keep eyes and lips closed while you try to open them. Have the patient identify if salt or sugar placed on the tongue. Cranial nerve 8, acoustic, vestibulocochlear. To test hearing, use a tuning fork or rub your fingers or place a ticking watch or whisper near each ear. Equilibrium testing is usually deferred. Cranial nerve 9, glossopharyngeal. Touch the back of throat with a sterile tongue depressor or a cotton-tipped applicator. Have the patient swallow. Cranial nerve 10, vagus. Assess the gag and swallowing reflex the same as cranial nerve 9 by touching the back of throat with a sterile tongue depressor or a cotton-tipped applicator and have the patient swallow, and also assess vocal quality. Cranial nerve 11, spinal accessory. Have the patient shrug shoulders and turn head from side to side. Cranial nerve 12, hypoglossal. Have the patient stick out tongue and have them move the tongue internally from cheek to cheek.